Considering the situation we are all in due to the COVID-19 pandemic, this is an attempt to give an intermediate support to patients until they can get admitted to a hospital. Here's the procedure and precautions for oxygen administration at home. A typical system consists of a cylinder with a valve connected to a pressure gauge, a flow meter with a regulator. To address the emergency oxygen needs, we provide cylinders with pre-assembled components. The oxygen given to a patient needs to have some amount of moisture. This is achieved by passing it through a humidifier. The humidifier needs to be filled with distilled water between the water level markings on the container and needs to be tightly secured. There needs to be a sealing gasket between the container and the cap to avoid leakage of oxygen. The humidifier is now fixed to the flow regulator. The cylinders we provide may come with either of the following regulators: one with the flow rate marking on the knob, and the other with a floating ball and a calibrated scale which indicates the flow rate. A Venturi mask and a tube is provided with the system. One end of the tube is connected to the mask, while the other is connected to the nozzle on the humidifier. The tube should be free of any bends. The valve is turned on and a deflection in the pressure gauge needle would be observed. The pressure gauge now shows the amount of oxygen in the cylinder. On turning the regulator knob, bubbles appear in the humidifier. The system is now ready for use. The mask can be worn by the patient, secured using the elastic band behind the head. The mask is positioned properly to ensure it's completely sealed. The flow rate is to be set according to the prescribed rate given by the doctor. Monitoring of oxygen saturation level of the patient would be required. A pulse oximeter should be kept handy if possible. Some safety precautions to be taken are to avoid the use of any petroleum jelly, grease, or any inflammable substances near the system. When not in use, first the valve, then the regulator knob are to be turned off, and the cylinder needs to be stored in a horizontal position on the ground to prevent it from tipping and falling off.